Right.
Right now.
I can use it.
Yes. Yeah, that
These are all good. I see how you work. No, that was a great conversation. Joni can help you.
No, actually, I can't. It's getting worse by the day. Age.
Look like they're talking right there.
And unfortunately, I was like, I don't know. Let me get back. That happens.
Okay, yeah.
How are your girls doing over at St. Joe's? I saw that you used a picture of them quitting. Like yesterday. Yes.
Well, I'm sure. How much you last year? She told her, I talked to her when she walks by the house.
Good afternoon, everyone. We're going to go ahead and get started. This is a pretty informal session because really we are here to get your input. That's what the whole purpose of this meeting is. And so welcome. Thank you for coming out on this very chilly day. I did want to say that what we're going to do is do a presentation. This whole thing will take about 20 minutes total. I will introduce our board chair, Jim Massey, and then we'll go from there. We'll show a video at the end. And then really we want to take the rest of the time to get your input on what you would like to see in the clinic building. If there are other services, just different amenities that you might want us to put in there. Because we just get one really good shot at this to be able to build this, and then it's yours to use. We do have our architect here too, so he is taking notes, and we'll bring him up as well. But very excited. This is kind of a challenging spot for a clinic, as you can imagine, because we've got a nice sized hill to deal with, but it also creates some nice features for the clinic as well. So again, welcome. We are putting this on YouTube. We are taping it just for your knowledge, so that people who can't make it, we get people from as far away as Florida who are snowbirds, ask that we do tape it and post it so that they can see what is taking place. So we are doing that at their request. And then we're going to repeat this whole thing at 5 o'clock for those of you who want to stay, or for those of you who need to leave, that's fine. But we wanted to try to get a hold of as many people as we could when they got off work. And we're very cognizant of the fact that people get off work at different times. So without anything else, I'm going to turn it over to Jim Massey. Jim is our board chair. He's not really retired. I would say he's retired, but he's not, because he's a full-time board chair with us. He also was the publisher and editor of a newspaper, and has been on our board now for 12 years. And has done an outstanding job of being the chair. And he's the one that really said after the pandemic started to wane, we really need to get started on these clinics. And so I'm going to introduce right now Jim Massey.
All right, thank you both. Welcome everybody. As Lisa said, I've been the board chair now. That's going into my 4th year. We had I started in that role in January of 2020, and like 2 months later we had a pandemic. So it was like a little bit of we had a few things going on in the hospital during that time. But today we're here to talk about we're pretty excited about moving ahead with the new clinic here in Middle Point. We purchased the Middle Point and Dodgeville Medical Center practice buildings in 2018 from the physicians who owned the practice. We made a commitment at that time that we would see how it goes with downtown facilities, and if we had to, we would expand or move elsewhere. And the practice has continued to grow, but we just know that we need to move the facility to a more convenient location for our patients. And the parking is difficult downtown. The access for people with disabilities is difficult down there. And for future growth, we figure we need more space. We'd like today, the purpose of this meeting today is to kind of discuss with those of you who are here what you'd like to see in our new facility. What kind of services you think that we should be providing in Middle Point? What do you think is lacking? What might we do that would help with the community here? So we have the new the water and therapy and water therapy pool in Middle Point here that's been open for maybe since 2017, maybe, I don't know, year since when? 2019. Okay. Well, that's a beautiful facility out there, and it's very well used, and so that's where we're hoping to build our new clinic there as well. So that's what the plans are. We've got an architect in tow, ready doing the design, and kind of bogged down a little bit during the pandemic with the whole process. But we thought once we're not totally clear of the pandemic, but we're getting there, and we thought it's time to move on these. So we're also doing something similar in Mount Horeb. We've got a clinic that we rent a facility in Mount Horeb. We'd like to own our own facility there, so we're in the process of doing the same thing. We're kind of in parallel with those two buildings. So we're moving ahead with that, and we're looking forward to having some nice new facilities and continuing to expand our services in both locations. So with that, I'd like to introduce Angela Turpin, who is our foundation director, and Angela will do some more, talk some more. We need that. Okay.
Thank you, Jim. Hello, everybody. First and foremost, I want to thank you all for coming. What a tremendous turnout. I really look forward to hearing all of your opinions and questions. A huge thank you to Cafe 43. They brought us some delicious food, so please make sure that you enjoy some food. And a huge, tremendous thank you to the Mineral Point School for letting us house this, and they've been incredible with helping us set everything up, so we couldn't have done it without them. I am actually going to introduce a video to you. The video that we have is a video we'd like to show to Mineral Point, just to kind of let you know the things that Upland Hills Health can do for the community and the things that we do now. Of course, Upland Hills has, we've been there for every stage of your life, and we continue to be there for every stage of your life. And with your support, we're only going to continue to get stronger. So I'll start the video.
Nestled in the beautiful hills of southern Wisconsin, there is a team of healthcare providers who value what you want in healthcare. Providers who listen, who want to know you as a person, partnering with you to achieve your best health. A hospital team that strives for excellence, exceeding state and national quality measures and patient opinion rankings. A healthcare system that attracts the best doctors, nurses, and healthcare team members who come to work to make a difference. Healthcare experts who are as independent and forward-thinking as the system that employs them. This health system is governed by a community-based board of trustees that evaluates each decision on how they would want to be treated and cared for, because this is the health system they want for their neighbors and friends. And while not in Madison, this hospital team carefully surrounds itself with the same experts you would see in Madison. Madison emergency physicians, Madison pathologists, Madison radiologists, and over 20 Madison specialists on site in Dodgeville. All of the expertise without the traffic, without the Belmont, without feeling like a patient instead of a person. What is this health system? Upland Hills Health. You might know Upland Hills Health through its hospital in Dodgeville. But today, Upland Hills Health is so much more than this. Today, Upland Hills Health is poised to deliver its vision to exemplify the highest standard of community health care and inspire patients to take an active role in their health through wellness-oriented care. Upland Hills Health employs over 500 people. In addition to doctors and nurses, Upland Hills Health employs people with many areas of expertise, from accounting to food service. All are essential to running a healthcare organization of this size. Upland Hills Health is nationally recognized for the quality of care provided. For years, the hospital has consistently ranked among the top 100 critical access hospitals in the United States, and has received 5 stars, the highest rating in patient surveys conducted by the Centers for Medicare and Medicaid, with clinics in 7 communities and home care and hospice services that go where the care is needed. Upland Hills Health is bringing healthcare experts into smaller communities to make getting the best care as easy as possible. You'll find Upland Hills Health clinics in Montford, Highland, Mineral Point, Dodgeville, Spring Green, Barneville, and Mount Morrow. Upland Hills Health Hospital in Dodgeville is the first hospital west of Madison on Highway 151. Many of the medical professionals available in Dodgeville are those also available in Madison. Upland Hills Health Emergency is staffed by Madison emergency physicians. Top-notch diagnostic lab and imaging services are reviewed by Madison pathologists and Madison radiologists, with results available quickly and efficiently through electronic medical records. More than 20 specialist physicians come to Dodgeville, available to you without the need to fight the traffic or find a place to park in Madison or Dubuque. Upland Hills Health is continuing to grow, serving the healthcare needs of the people of Southwest Wisconsin. Plans are underway for a new medical building in Mount Morrow with a family medicine clinic, physical, occupational, and speech therapies, and other services. A new clinic building is being planned for Mineral Point as well. In addition to family medicine and the aquatic therapy pool, it will include an area for fitness equipment and other medical services. In 2024, the Dodgeville Medical Center of Upland Hills Health will move into a new facility, and the emergency department at the hospital in Dodgeville will be remodeled and expanded into new space. The leadership team at Upland Hills Health wants to hear from you, the people they serve. Share your ideas for healthcare services and partnerships that you want available to you here in your community. Upland Hills Health meets the needs of the community it serves by listening and responding. Share your vision with Upland Hills Health. Join them to create the future of healthcare for you. Call their comment line at 608-930-7100 or send your ideas through the Contact Us page at uplandhillshealth.org, or watch for Upland Hills Health Community Forum scheduled in your town. Upland Hills Health Hospital and Clinics, providing innovative, individualized, and compassionate care for every stage of life.
Okay, well, now you know as much about Upland Hills as we do. The reason we're here, as we said, is to hear from you, not us to not this to be a one-way conversation here. So we'd like to know what you think about our plans. What do you think might add to our services here that that Interpoint doesn't have now? What are your needs in this community? So we'd be welcome to open the discussion here to see what you might think. Yes, sir.
Just to ask, are you talking about starting from scratch, or are you talking about redoing the building that's there?
Question is, are we starting from scratch, or are we doing the building that's there? We're talking about the building out by the therapy pool. We're going to be adding a building, probably be attached to that building. It won't be starting from scratch. We'll be using what's there that's already being used for the water therapy and the regular therapy. But there'll be other services that will be added with the new clinic there attached to that. So
I just spent an hour and a half at the dental office next door, so I was wondering where we're gonna put this and have parking. That's my question.
Okay, well, we know that we're gonna need fill out there because if you've been to the parking area in the back of that therapy area, it drops off pretty quickly. So we're probably gonna have to, depending on where we attach this building, we'll have to do some fill out there and add the new clinic. So we have an architect here who can maybe tell us a little more about that, but we're still in the development stage with that, but so we really can't go into a lot of detail because we're still deciding what's all going to be there. So as we're developing it, but the aggressive plan, I don't know if we want to put any date on this yet, but we're hoping to get going here in the spring when the weather changes.
I was envisioning a 7-story structure.
It's not going to be a skyscraper, I can tell you that.
Sure. Thank you for your question. It's, what we would want to do is be really respectful of that existing building and also improve access for your patients and give a really state-of-the-art clinical setting for the providers within the Upland Hills group. I think the biggest challenge will be, just meeting the cadence of the schedule, and the site itself is a really terrific site. It has lots of views, and I think it would be a great place for this community to get medical services.
This is Rich Dunham from the
EWBR, sounds like a radio station, but we have multiple offices. We have an office in Madison, but you don't want to hear a commercial about us. So.
I was getting BWBR mixed up as B something, but anyway. Thank you, Rich.
Thank you.
Okay, any other questions here?
So timeline,
Timeline.
you're not gonna break ground without a plan.
No, but we're moving ahead quickly with the plan as it's developed here. They're doing some architectural designs already, but aggressively, we'd like to have it done by late this year, early next year. So that's that.
That's relatively accurate. It's very accurate. So I think that we are rapidly putting this together to meet the needs of your community. So.
We had done some architectural designs and things, not necessarily designs, but some plans before the pandemic, and so we're not starting totally from scratch with this. We are kind of, now that this is behind us, we think we can move ahead a little more rapidly because we're gonna kick it behind here. So, anything that you think that Centerpoint could use as far as yes. Pharmacy attached, that's to be determined. I don't know what I can say about that, but we've been in discussions with the pharmacy downtown. I guess we can say that, but that's to be determined yet. Yes.
There was mention of having a space for exercise equipment. Will that replace the current exercise facility that's in town here?
Okay. Yes, we did find that, yeah.
Okay, so I'm very excited about the new buildings. I don't want to be a naysayer, but if you're talking about potentially moving a pharmacy out of downtown and the clinic out of downtown and the fitness center out of downtown, have you thought at all about the impacts to what that part of Main Street looks like?
Certainly. We do want to work with whoever purchases the historic building that we're in now to make it, it seems like every time there's a historic building that comes up on the market here, somebody finds a use for it, and we're hoping that happens. Yes, we're taking the business from downtown, but we are not leaving town. We are expanding into your community and making it a more readily accessible facility. You have to admit that it's not the easiest to find a place to park and get into it. Maybe you're halfway down the hill, and so it's a building that we didn't think that we could invest in it to make it to really expand our services there. So we thought we had to go elsewhere. We don't know about I won't say for sure the pharmacy is leaving downtown, because we don't know that for sure yet, but has to be determined soon, because we're planning that, as we design the building, we have to know that too, so. But that's to be determined soon.
Workout center.
In the workout center, that'll be, I don't know, what's the size of that, percent, maybe, you know?
So we currently lease the space for the fitness center, and so it's always been the plan from the time that we merged with the Mineral Point Medical Center that we would probably do the fitness center if we ended up moving the clinic on site. But when the clinic got delayed, people were coming to us saying we have to have a fitness center now, which is why we lease that space. So we don't own that, and it's always been the intention of moving it. Also, we have our PT area there, and so our hope is that maybe at some point, some of the athletic trainers could possibly do personalized workout plans for people in the fitness center with that close proximity. But that's always the fitness center's always been the plan. I have to say, others have come to us and said, if you're gonna move out there, would you consider having space for us potentially? The gym is right, nothing in terms of finances or rent or lease or building has been discussed. It's just been conversations today.
She leaves me. Okay, other questions, any other input? You're looking for ideas of what you need, what you want.
Have you thought about a dialysis center?
Dialysis center, I think we're pretty well set on the dialysis in Dodgeville. We sold our dialysis business maybe 15 years ago. No, it can't be that long because I was
5 or 6, maybe 6 years.
6 years. Okay, go ahead. That can't be that long.
So in terms of dialysis, what we found is a really great question. What we found when we were owning our own dialysis center is that Fresenius owns the chairs, they own the drugs, and they own the processing units that they sell to everybody else. So they literally were paying pennies for drugs we were paying hundreds of dollars for. And that's how they're able to run those things so effectively. They also have incredible computer systems for quality analysis. All of the quality data for all of the Fresenius centers goes to a center in Germany where it is processed. And they can tell if anything is even slightly off for a patient. We didn't have that capacity. And so SSM had the same conclusion that we did. They looked at the financing of it, they looked at the quality of it, and also we looked at the ability to expand. We couldn't expand our service anymore because we couldn't staff a third shift. So we joined SSM, all of the Madison facilities, the Baraboo facility, and then our facility, and we sold to Fresenius. And to be honest, the board really was strong with them and said, you cannot close this center. We don't want to just be an afterthought. And they made a commitment and they opened up a whole new shift for patients in Dodgeville. So that would be a Fresenius decision whether or not to expand. But if anybody could ever go into a smaller area, they have the low cost point where they are able to do that.
Dialysis decision, as far as us starting dialysis in Dodgeville, was before my time on the board, but that was a community need that we saw, that it wasn't a moneymaker for us. I mean, not everything is a moneymaker that we do, but it was something that we thought was important in the community, and people were driving to Madison or driving to Butte, and so we decided that we would do dialysis, but it made more sense when Phineas would do it and expand it even further. So I think we were doing 12 patients or something, and now it's 18 or more, maybe it's more than that even, but it's a good service to have. And we hope that most of our patients within our whole service area can make it to Dodgeville, and but then again, like Lisa said, maybe Fresenius would decide at some point to expand locally, but we don't know that for sure. We haven't discussed that part. Anything else?
Will Subway be relocated?
Subway be relocated. We do have a contract with Subway that I'm not a lease agreement.
So when we acquired the Subway building, we acquired the lease. And so they have the right to be there for at least 7 more years. But I can tell you, And I think Dr. Fox, who's here, will tell you too that the number one question we get where people start to panic is Subway going away? And so we see a real synergy between having Subway there and our being there. So I think our staff wants to keep Subway too. Our patients certainly want to keep Subway. And I use Subway a lot too. So I don't see them moving. I won't say never ever, you can't in this market, but it's been a good thing for us. And they have healthy options, which is also really great for our patients. I don't know, Dr. Fox, if you want to say anything else in that regard, but I know she's made sure that we hear the comments that she hears.
Who doesn't want a clinic that smell like fresh bread?
The smell of fresh bread.
Yes.
Calms all the patients.
Okay. All right, that's a good input, we appreciate, yes?
That's another really great question. So one of the things that several community members challenged us with when we were looking for a place to put our therapy center was to purchase a lot large enough that if the community groups that were working on a swim team in an indoor facility needed space, that we would have the space to do that. And so we hired the architects and they found that the lot kind of behind us that we own would be large enough to put a pool on if the community would choose to do that. I know Dr. Fox was part of that, Skip Lee was part of that. Since then, those conversations have kind of died away, but what I've been told recently when I mentioned that is that there's a community group right now that's working between Dodgeville and Mineral Point to see if there might be a rec center that can be put between the two communities that would house an indoor pool. But I think that we're very supportive of that. We don't want to own it, but we certainly have the land that would support that.
Yes.
With the downtown buildings, you say we build it, is there a chance you might stay there on some level, maybe a building center or something, so that it is not empty? I'm concerned about the impact that this move is going to have on downtown.
Yeah, we knew that when we were gonna make this decision, that there would be some people that weren't gonna be happy about that, but we also knew that we had to make the decision to expand. I can't envision a way that we would keep a presence down there with our clinic or therapy but.
Yeah, Jim is correct. We did engage the city early on to let them know, long before we planned these meetings, that we were going to likely move out of that building. Our biggest concern is to find an entity that can come down there and can bring the volume of traffic that the clinic brings. Our fitness center, to be honest with you, doesn't have that kind of volume. And so the city is encouraged that working with economic development and the chamber, they feel that they've got a more active group right now that we might be able to find a use for that building. But that's our goal too, is to find something that would bring more traffic downtown. And it's going to be a challenge for all of us. And I think I live in Point too. I think we all have to kind of work together and think about what that could be. And the city's very engaged. They want to see that building put to use as well. So the fitness center probably wouldn't meet that bill just because we don't have that kind of volume of clientele going there right now.
Other questions, concerns? Dean?
You mentioned the pharmacy. If Sarah decides that she doesn't want to be on the keep the pharmacy where it's at, would you put competition against her?
Oh, boy. I'm letting her do that.
No. Yes. So we have a really good working relationship with Sarah, and that's my pharmacist too. And I would say that I don't think we're even in that realm of discussion in terms of whether or not we would compete with her. I think the discussion to date has been, does she want a satellite out there, or does she want to work out there, or how does she want to manage that? To be honest with you, we did a survey of some of our staff members, and 100% of the staff that we surveyed, they all use drive-through pharmacies. I don't, because I go to Sarah, but they all go to drive-throughs, and so their urging was that Sarah consider having a drive-through pharmacy there for the convenience of the patients. And so that's what we're seeing. Now that poses a huge challenge, I can tell you, for our architects. And I think Rich told me if there's one thing that keeps him up at night with this building is the thought of putting a drive-through pharmacy in there. And we have looked at pneumatic tube systems, we've looked at windows that come out, we've looked at all kinds of things to see if we can accommodate that. But that's just kind of the way things are going. If you go to McDonald's right now, nobody's inside, everybody's in the drive-through line. And I think we need to get Sarah to that point too, if we can, if she chooses to do this. And again, there have been no contracts, no financial arrangements between us, so I don't want to say she's coming because that would be a real forward leap. But I just want to let the community know that we are very supportive of Sarah and Avides, and we do not want to compete with her.
Glad she took that one. Okay, next, any more? We're happy to see this group here. I mean, we don't know if we have something like this and two people show up or that's great. So.
Will there be a capital campaign?
Angela.
Are you offering?
No?
The plan is yes, we hope to do a capital campaign to help with some of the funding for the clinics. So to answer your question, yes, you will see my smiling face more.
I'll look forward to your live.
What was that?
I'll look forward to your live.
Yes.
I just want to add one thing to that. Because we did a capital campaign for the new building, and we assured those people that within their payment plan, some people are still in their last 2 years of their payments, we would not approach them again during that payment period, and we are honoring that. So we are not contacting anybody that's currently paying off their current pledge.
With that being said, if you would like to donate and you're doing your current pledge, please contact me.
Okay. All right. Anything else? Yes, Mary?
Is there a total cost?
Yes.
And how big will the building be?
Rich? We don't know the total cost yet, but we're getting close to that. I mean, that's estimates.
In general, we're talking about a two-level building, and the total square footage should be in the neighborhood of around 24,000 square feet. And it will be connected to the subway building or the structure that exists there. Okay,
All right.
Are you implementing any energy saving things like solar or anything?
Where's Ryan?
Okay.
It's Ryan, I saw Ryan.
Ryan's here. Okay.
Okay, Rich.
So Rich, again, the question was whether if we're implementing any energy saving component to the building.
I think in general, any modern building, we would be implementing the program. We have it internal to our office. So it's part of our process of developing the project, because we all want to be good stewards of the earth and make sure that the building is very efficient, as well as planning and mechanical systems that support it.
Okay. Dean?
Is there any thoughts to bringing any optical services?
Well, that's why we're here today, to see what you think is a good idea to bring here. I mean, we haven't made any final decisions on that, but we're open to that.
Great suggestion.
Yeah, and that's why we need to know soon on what are going to include, because we have an architect working on it. So we may build extra space for future services that could be added to the building, to the community. So that's a possibility. That's one of that's been discussed. And chiropractor's been talked about. There's other things. So.
Along that list, how about like dermatology and behavioral health services? Are those things
Dermatology and behavioral health services.
So in terms of dermatology, we have not explored that, but in terms of behavioral health, it is our goal to eventually, in our larger clinics, I can tell you Mineral Point is our largest clinic. So it has the largest number of providers and the largest patient base. We are trying to get to the point where we can embed behavioral health within each of our clinics to some degree. We have one behavioral health specialist that we've hired, Barb Cole. We are in the process of hiring 1 to 2 more, and we think that they will have full panels as soon as we get them hired and credentialed. So We see this as a huge expanding service and a huge community need, and so I think that, yes, you'll see a day when behavioral health will be here too. I don't know, Dr. Cox, if you want to say anything more about that?
Yeah, I think that is definitely a goal, to, so the potential space at this new clinic. Right now, we have space in the Point for 5 providers, so physicians, and nurse practitioners and PAs. This would probably expand that to a total of 6 spaces for people to see patients, and that 6th person could be visiting specialist, like maybe the orthopedist doc comes down, or if we don't really have another specialty like sports medicine or something like that, that person could potentially have a part-time home in Mineral Point. Behavioral health would be probably a little bit more like a full-time home there, but they don't need quite as much space as what somebody seeing several patients an hour would see. So we are able to fit that in a little bit more easily than one of the specialists. Dermatology, I don't see that happening in Mineral Point, but I think the eye services, I think that would be a really big, I mean, that's a gap we've had for quite a few years now in Mineral Point, and I think something that people would be interested in seeing. It probably would be a full service, like ophthalmology kind of clinic, but optician definitely, optometrist would definitely fit into that space.
We've done community needs surveys of all our communities, and behavioral health is toward the top of the list of every survey we've done, so we know that that's a need. So we will keep trying to provide that service somewhere within our community, our system. So,
When do you expect to have drawings available so people can visualize what's gonna happen?
architect. When will we have drawings available that people might be able to visualize what we're doing?
I have to be real careful about how I answer this question. I think that the best way that we would approach it is our process is to collaborate with Upland Hills and the community, and we will share the drawings as they're available and approved.
You say within 2 months, so.
I would say in general, I would say early spring. We would.
Isn't that the same time we want to break ground?
No, gosh. There's a series that you can imagine. There's a lot of complications to understanding the site subsoils and all the services that need to be there as we expand. As a point of clarification, the existing building is around 10,000 square feet, and we're adding 14,000 square feet, so we get a total site of 24. I don't think that answers your question directly, but we are going to move as rapidly as we can. We have mobilized our team, and we're looking to pull everything together so that we can price the project. And we have a construction partner. We've talked about that. We have a Madison firm, and then we also have local contractors that are going to be part of the clinical upgrades and new buildings. So those, I think, you're in the process right now of selecting the local contractors that are going to be part of this project.
We have Findorf is kind of overseeing the process, and then we hope to hire local contractors as much as we can for do the work on the project. So. Okay.
How about roads?
Go ahead.
Only because it'll bring a lot more traffic through those intersections that serve that area right now, which can, the traffic's starting to be kind of scary.
We could use a roundabout.
Yeah, no, but, well, the access on and off the highway by the mobile station, by, if you come out on the, and by the dental clinic, that's a busy road. You're gonna come through the back.
I don't know if that's part of the architectural design or not, as far as the road go. I mean,
Or at least entry points into the place.
Yeah.
yeah.
we're looking at making a very efficient parking layout, so there will probably be more than, probably one new entry point or two. We're in the process of defining that. We're working with a local civil engineer, site designer, and they're finalizing their plans. I think that the idea is to, again, make it very efficient, still maintain and keep all the existing spaces that are out there right now, and limit the impact to the total site. This site has got it's got 3 sides, you can access it, so it's really quite a good site from that perspective of site circulation, parking, and making sure that the entries are safe and that we've got the right approach and access for the patients.
Mitch, you have a question?
2 things. Somebody that lives next to the old track that is not accessible right now in the winter in the fitness center, is there plans for some potential indoor walking areas? I know I see a lot of people that do rehab during the good weather, but is that something that would be looked at? And my second point would be, the school district is trying to write some grants to bring in some counseling services. There are none in this part of the state, where a lot of school districts on the eastern side of the state of Wisconsin have that opportunity. And I don't know if that's, kind of along the behavioral sciences, but things that you might consider bringing in that maybe other local school districts could tap into for the needs of their families that, that they serve.
That's a great point. We've talked to other schools about embedding counselors within the schools. I don't know if you recall, maybe 3 or 4 years ago, Mount Orr was giving quite a bit of time with behavioral and mental health issues with their students, and reached out to us, and so we were working with them on that project. But it'd be interesting to continue that conversation, which to say, is it better to come here or better to embed within the high school, the high schools? But the board has set as one of our top 3 directives addressing the behavioral health issues in the county, and we're committed to that. The second issue about an indoor walking track, we have asked our architects to look at that. What's becoming challenging on that is it seems like it will only be able to be 2 hallways. And so the question we left them with was, how many times do you have to walk those 2 hallways to make a mile? And is it really worth it? We don't have that answer back yet, but we were hoping to have a 4-sided track. When we got down to 2, we started to wonder if that really was going to be worthwhile.
Okay. Other questions, comments? Yes, sir. X-rays and MRIs, yes. Well, not MRI, it would be, not MRI, not, they would be in the hospital, at the hospital. X-rays, right. No, you wouldn't want, they cost like $1 million for that MRI. All right, we already purchased an X-ray machine for the clinic, so that's gonna happen. And we just purchased a new MRI machine for the Dodgeville facility, so $1 million here, $1 million there.
Is your plan to move a lot of the stuff out of the old building up to this new clinic, or are you updating the whole works?
So we really are turning to the physicians and the clinic staff to tell us what goes and what stays. I know we just purchased a number of new exam tables. Those will definitely go. And then each piece of equipment will be assessed. As Jim just said, we just spent over $100,000, it was $150,000 on just the X-ray unit for the Mineral Point Clinic to make sure that it was, state of the art. But I don't know, Dr. Fox and Andrea, if you want to address anything more about what's coming and going. I know you said the exam tables were definitely going to go.
Yeah, I mean, we have an EKG machine that will come with us. We have, computers and things like that. So I would say the updated equipment that we have recently will all come with, and the things that are, office chairs and things like that have been there for 30 years, we're probably going to get some new ones that way. But the new exam tables are just within the last year, and those will definitely all come with us.
Again, the robot lady that answers the phones and tries to direct me your way.
Okay. Okay, other questions, comments? It's been great, we appreciate it very much. We're taking notes, right, Amy? And we're having regular meetings with our architect and our board and our facilities planning committee and our physicians are part of it and trying to design this new facility and are going to incorporate all your ideas of the whole thing too, so.
Just want, before you conclude, Jim, I just wanted to say, if you have any additional comments, like you go home, if you're like me and you think, oh, I should have said this, you can go to our website. There is a comment link there. Jody, I don't know if you want to talk about how to get to that comment link, because you're the expert in that area. She's our digital expert.
Sure, yeah, on our website, if you go to uplandhillshealth.org, it's in the upper right corner, it says contact us, and it's a form you fill out, and it'll come right to the inbox. So, yeah, if you think of something afterwards, please send it in.
And you can always email any of us. Our email is always our last name. So in my case, it's Schnebler with the letter L, your first name, your first initial, and then at uplandhillshealth.org. That holds true for all of us. But we want your comments. We take them very seriously. In fact, some comments that we got in Mount Horeb initially gave the board pause to consider some new options as well. So we want this to work for the community. We don't come in with any preconceived notions at all. And like your suggestion about an optometrist, that is new for me and something to kind of mull over. But anything like that that you would like to see, we want to accommodate.
Any other comments here? We're gonna do this little program again at 5 o'clock for those who, might have come in late, but, we have refreshments back there, we'll make sure you get some of those before you leave. And take some home. So, nothing else. Thank you very much for coming.
Thank you.
You'll be all right.